I'm Monica White. I'm an acute care nurse practitioner and I work with Texas Oncology in East Texas, Longview, Texas. And I'm at JADPRO 2025 National Harbor and was very blessed to be able to be a part of the bone marrow biopsy instruction that we do most every year for APPs that come from across the country to learn how to do bone marrow biopsy. And I have two colleagues that actually worked with me on this, and we also instructed APPs on how to do Omayo reservoir appliance and as well as the lumbar puncture. So my focus was actually instructing on the bone marrow biopsy with my colleague. And we took a little bit of a different approach this year, and I think it's been really well received from APPs across the country. I learned bone marrow biopsy from a physician many years ago, and it takes a while when you are learning on human beings. It's just different than if you're able to learn on a simulator. And so fortunately, there's a company that makes the bone marrow body model, and we use those simulators to teach APPs how to do bone marrow biopsy. And it's on the simulator, you can get all the jitters out and kind of work through that process. And I've actually used this in my practice as well. So when I have instructed people on how to do bone marrow biopsy on individuals, they tend to ramp up a lot slower. And in the last few years where I've been using the bone marrow biopsy model and simulator, APPs ramp up so much quicker because they're able to just practice many times on the simulator and then transition to where they're doing it on people. So what Kevin and Laura and I did this year was a little different. We actually had two groups, and this is a pre-conference session. And in both groups, we started with kind of general discussion about the soft side of procedures. And so it's nice to have a procedure as part of your practice, the technical part, because so much of what we do is, physical exam and things with patients. But this is kind of a technical piece, and I think APPs are well suited to do this because we take our time, and now we're teaching in a way that we're able to become proficient before we start doing this on a person. So we talked about the soft side of bone marrow biopsy in particular, and that is where you're preparing the patient for a procedure. So if you think about how that would feel as a person, and you're either laying on your side and your face is away from the person that maybe you don't even know doing the procedure, or you're laying prone so that your face is down, you can't see what's happening, and it's really a very vulnerable space for patients. Not to mention the fact that they are going through cancer and cancer treatment. And this may be the first time they've ever had the procedure. It may be the 6th or 7th time, because we're doing that procedure to know, do they have myeloma? And so they have to have these rechecked over a series of years to see if they're responding or if they're progressing. So talking about how to put the patient at ease, and the more calm and confident we are as providers, the better the patient's going to respond to that. And so even if you have some anxiety going on the inside, just to be calm and confident on the outside. And so kind of practicing, what you're going to say to a patient. So I usually go into the patient, I talk to them, let them know what to expect. It's really important to have support staff. So I have an MA that works with me. She also is very well prepared to talk to patients about what they're going to go through. And then she gets the informed consent. So when I go in, it's more of a high level. You know about the procedure. What questions do you have for me? Obviously, we're going to check, are they on anticoagulation? And not that it needs to be held, because largely none of us really hold anticoagulation unless it's institutional policy. And then we talk about allergies. Do they have any allergies we need to be aware of? Because we are going to prep their skin and have a sterile field to do the biopsy. And then I usually say to people that, so this is going to take, probably 10 minutes start to finish. And during that time, there's gonna be no surprises. So I just want you to relax. Your job is to relax. I'm gonna walk you through the procedure, and I'll let you know. There are gonna be a couple of times you might feel a little bit of pressure or a pulling sensation. I'll let you know when that's gonna happen, so you never have to be tense. And largely that works so well for patients. And then there are aftercare considerations to talk about, putting some pressure for 10 to 15 minutes so that they don't have bleeding by the time they're leaving. And then what to do if they do have, some kind of a hematoma, bleeding, that kind of thing come up. So just preparing them start to finish through the whole procedure makes a huge difference. So Kevin and Laura and I talked about those kinds of things this time up front. And I think it was helpful in kind of setting the stage for what came later for the procedure instructions and that kind of thing.